Hey friends, welcome back to the channel in another video. My name is Dr. Caroline, a practicing board-certified family medicine physician, and this channel is created to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. And if these kind of videos are interesting to you, then definitely make sure to subscribe. Now, in today's video, I want to share some tips on how to actually be productive at work as a primary care physician. This is one of the things I struggled with early on as an attending. I knew how to work hard and be busy, but I didn't know how to actually be productive in the full sense of that word. Now, productivity can mean different things for different people in different fields of work. The way I've been able to learn it and the way I discuss it in my videos here on YouTube is in the sense of how to work smart and not just hard to get the maximum amount of work done in the most efficient way and how to turn that productivity into revenue. Now, I have an entire program on this. Of course, on YouTube, I discuss several different topics using my own experiences as a guide, but in the program, we are very focused and very directed in teaching the practical strategies on how to maximize productivity and scale revenue. Now, one thing I want to mention is that the name of the program is RVU Consulting, and RVU stands for Relative Value Unit, if you didn't already know. And actually, if you didn't know, I do have several videos talking about the basics of relative value units and how that translates into revenue, so you can definitely check those out if you want to. But again, the program is called RVU Consulting because I practice in an RVU based model, which is a productivity type model. Now, if you don't practice in an RVU based model, it does not mean that this program is not for you. This is how I want you to think about it. If you have the potential to earn a production bonus, or if your revenue is able to increase based on productivity, then this program will work for you, because your production bonus does not need to be called an RVU bonus for this program to work for you. Your income's potential to increase based on productivity is what we focus on. So it doesn't need to be called RVU productivity for this program to work for you. So I wanted to mention that because I don't want the name of the program to deter someone from being able to benefit from this program. So if this sounds interesting to you, definitely check out the link below. So as I've lightly mentioned earlier, being busy and being productive are not the same thing. So if you're out there at work in your clinic and you're being busy all day, but you're burnt out, your revenue is suffering or is not where you want it to be or whatever, then you're very likely not being as productive as you can be, and this video is definitely for you. So the first tip is you have to get efficient. Efficiency is by far, hands down, one of the first things you have to establish in order to be productive at work. Those two things go hand in hand. You can't avoid it. You have to have a systematic approach to your work. What do you do when you first get to work? How do you approach each one of your visits? What do you do in between seeing patients? What do you do during your lunch hour? And hopefully you're actually taking a break and eating your lunch because you need that energy. You need that midday recovery. So definitely take your break because you don't want to burn out. And if you're constantly being interrupted during your lunch hour or your break time, then you need to establish boundaries. The next tip is minimize distractions. You have to establish the mindset that when you're at work, do the work. Because think about it, you have these several hours when you're away from your families, away from the fun things that you enjoy to do, etc. So make it count, so that way you get your work done on time and you're able to leave on time to be able to have that free time to be with your families and be able to do those fun things, etc. So stay off of social media. If you have social media, I know not everybody does, but if you have social media, you don't want to waste your time scrolling through social media whilst you're at work. Reduce unnecessary chatting with coworkers and staff. If it's not about patient care, then it's not the time for it. Save that for your lunch hour or your break time. Now, some distractions are unavoidable. So for example, like if you have young children in daycare or in school and you tend to get updates from their caretakers or their teachers, then that's fine. Definitely check those updates, no issues at all. But anything that is an unnecessary distraction is what I want you to stay away from. The next tip is learn to delegate tasks appropriately. You do not want to spend time or waste time doing tasks that someone else can do or that someone else has the training to do. This will literally just eat up a big chunk of your time and your energy, and you're very unlikely to be productive. So use your time to perform your job as a doctor at your maximum potential. Now, the next tip is a big one, and it's about administrative tasks. So reviewing lab results, replying to messages, calling patients, completing paperwork, all that kind of stuff. If completing these tasks is the bane of your work existence, I completely understand and I got you. I have actually created this exact video on my channel titled How I Manage My In-Basket for Maximum Productivity, and that is the video I want you to watch after this video because I definitely think it might help. Having a systematic approach to managing my in-basket has been one of the best things I've done to reduce the risk of burnout, but also ensure that I stay productive. So again, I hope that video will be helpful for you as well. The final tip is figure out what you enjoy most about your work and try to maintain your focus on that in order to boost your energy throughout your workday. In any job, in any field, you may not enjoy everything about your work. Now, I can't speak for you, but I can speak for myself. I don't enjoy everything about being a primary care doctor, but the things that I do enjoy, those are the things that I allow myself to focus on so that I don't get drained or risk falling into burnout. Because if I focus on things I dislike and it takes up my mental space, then that will quickly drain my energy, and getting through my workday is just going to be a struggle. So again, figure out what you enjoy most about your work and maintain your focus on that to be able to boost your energy throughout your workday. Alright friends, I hope you've enjoyed this video and I hope this information was interesting to you. If you enjoy this type of content, then definitely consider subscribing, because I do post a video like this every single week, doing my best to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. Again, check out the link below to my RVU consulting program if you'd like to learn the practical strategies to maximize productivity and scale your income. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.